Hello students, in the continuation of temporal bone part 1, today we will discuss the part 2 of the temporal bone. In my class of the part 1, I already told you about the detailed of squamous part. Now today we will discuss the petromastoid, tympanic and styloid parts of your temporal bone. So let's discuss first about the petromastoid part of temporal bone. Now my dear students, you know that there are two words, petro and mastoid. So we will discuss the petrous part and mastoid component separately. So first I am telling you about the mastoid part of temporal bone. Now when you will see the mastoid part, it lies on the posterior side of temporal bone. So when you are holding the bone in anatomical position, I have already told you that your mastoid process lies behind external acoustic meatus. So this is external acoustic meatus, and here you can see that this prominence is known as mastoid process, and this is the part of your mastoid area of temporal bone. So the mastoid area or the mastoid part lies behind your external acoustic meatus, and it is the posterior part of temporal bone. So this should be very clear in your mind. Now the second thing is that when you will see the mastoid part, it is having two surfaces and two border. What are the name of surfaces? Outer and inner surface. Two borders, superior and posterior border. So we will see these surfaces and border one by one. Now it encloses the mastoid air cell. Now this is again the important thing, that there is a presence of the air cells in the temporal bone. Now you have this question, which part of the temporal bone consists of the air cell? Answer is mastoid part of temporal bone. Now the outer surface form the downward projection, and that projection is known as mastoid process. Clear? Now first we will see the outer surface of the mastoid part of temporal bone. So the outer surface give attachment to the occipital part of occipitofrontalis muscle. Now we have seen this occipitofrontalis so many times, like in the lecture of scalp, in the lecture of norma lateralis. You will find that occipitofrontalis is a muscle which is present in the scalp. Now it is having two parts, occipital part posteriorly and the frontal part anteriorly. Now this occipital part attached on the outer surface of this mastoid part of temporal bone. Apart from that, there is a presence of the mastoid foramen. Now this mastoid foramen opens near the posterior border of the mastoid part, and it transmits the emissory vein from the sigmoid sinus, and it also transmits a branch of occipital artery. So now in this view, when you will have the norma lateralis, and if you are holding the temporal bone separately, you can see that this is the posterior border, and near the posterior border you will find a very small foramen, and this fine foramen is mastoid foramen. Now dear students, here try to understand that this is your occipitofrontalis. Now this is your temporal part. Now here you can see that this is your temporal part or the temporal bone in norma lateralis, and here you are able to see this is the location of your mastoid foramina, and this occipital belly is attached on this area of your posterior part of mastoid area. Clear? Now this is the important thing to understand, that I told you there is a presence of these mastoid foramina. Now here you can see that this is the extracranial vein, it is a occipital vein, and from this vein you can see that this is a blue line connection. Now this connection, which you can appreciate here, is your emissory vein, and this vein is entering at this point. Now this point of the entry is your mastoid foramen. So let's see this video clip to understand the connection of this occipital bone with inside sigmoid sinus. So when you will remove the occipital bone from the posterior side, now you can see that there is a presence of the sigmoid sinus inside the temporal bone. Now this sigmoid sinus, which is present on both sides, here you can see that is having a connection, and this is the emissory vein. So what is the emissory vein? These are the veins which are connecting this extracranial vein with intracranial venous system. So this is the point from where you can see that this vein will go, and it will go inside to connect this extracranial vein with this dural venous sinus. So my dear students, you will find the presence of the mastoid foramina, and these foramina is a passage for the imaginary vein which connect this extracranial vein to the inner side placed sigmoid sinus. So, when you will have the dry temporal bone, you will find a groove is present on the inner side of the mastoid part, and this groove consists of your sigmoid sinus. So, when you will remove the sigmoid sinus, now you can see that there is an inner opening of the imaginary vein is visible here. So, this is the connection between the sigmoid sinus and extracranial vein with the help of imaginary vein, and imaginary vein passes through this part of the temporal bone, which is the mastoid part, and for that you are having external opening that is known as mastoid foramen. Now, we will talk about the inner side of the mastoid part. Now, on the inner side, I have just told you that you will find a groove for sigmoid sinus. So, here you can see that this S-shaped sulcus is known as sigmoid sulcus, and this sigmoid sulcus consists of sigmoid sinus. Clear? Now, what is about the borders of the mastoid part? So, there is a superior border and there is a posterior border. Now, my dear students, you have to understand that this is your temporal bone. Now, this temporal bone is making a joint here. Now, this point of the fusion, you will find there is a presence of the triangle. Now, this is a triangular suture, and you will have this triangle as a asterion. Now, this asterion is a point where you are having articulation of this angle of parietal bone. Now, what is this angle of parietal bone? It is a postero-inferior angle of parietal bone, and this is the posterior border of your mastoid part, and this point is known as asterion. Apart from that, you will have another suture is occipito-mastoid suture. Now, this is the mastoid part, this is occipital bone. So, this area is known as occipito-mastoid suture. So, this is a occipito-mastoid suture and this area is asterion. Clear? So, this part is articulating with the parietal bone, and at this point you will have a fusion of three bone, occipital bone, parietal bone and temporal bone, and this triangular suture is having a center point is known as asterion. Now, what about the mastoid process? Now, we will come particularly on the process. So, on the mastoid process, the first question is that this process is not present at birth, it appears at the second year of the life, and this is having the medial and lateral surface. So, lateral surface is visible on the outer surface and the medial surface is on the inner side. Now, the lateral surface of the mastoid process, it gives attachment to the three important muscle, sternocleidomastoid, splenius capitis and longus capitis. Now, sternocleidomastoid is the outer muscle and longissimus capitis is the inner muscle. So, when you will go from superficial to deep, you will find three muscles, sternocleidomastoid, splenius capitis and longissimus capitis. So, let us see these three muscles in this video clip. Now, here you have to understand that this is the external muscle. Now, this most external muscle is sternocleidomastoid. Now, if we will remove these sternocleidomastoid of both the side, you will find the second layer, and then deep to that you will have third layer. So, my dear students, if you will see this video clip, you have to understand that this is your temporal bone, this is the mastoid process, this is the insertion of sternocleidomastoid. When you will remove the sternocleidomastoid, deep to that you will have splenius capitis. Now, when you will remove the splenius capitis, you will find that there is a presence of longissimus capitis. So, you will have the three muscles from superficial to deep. Clear? All the three muscles are attached on this outer surface of the mastoid process. What are the three muscles from outer to inner side? Sternocleidomastoid, then splenius capitis and then longissimus capitis. So, all the three muscles are attached on this outer surface of your mastoid process. Then you will have medial surface of mastoid process. Now, this medial surface of mastoid process is having two very important bony features which are the question of your exam. The first feature is mastoid notch and second is groove for occipital artery, which is known as occipital groove. So, mastoid notch is for the origin of a muscle, name is posterior belly of digastric. So, it gives origin to the posterior belly of digastric, and occipital groove is consisting the occipital artery. Clear? So, when you will see this mastoid process on the medial side. It is, I'm not talking about outside. Outside you will have three muscles. On the inner side, on this area, you will find the attachment of your origin. And which muscle is arising? Now here you can see this is the posterior belly of digastric. This is the anterior belly of digastric. So posterior belly arises from the medial surface of mastoid process, which is known as mastoid notch. So this is the occipital view. This is norma occipitalis. Here you can see that this is the inner surface of mastoid process. Now from this inner surface you can see this is the origin and this is the posterior belly of digastric, and just adjacent to that you will find a groove, and this groove is having the occipital artery. So what are the two questions here? First is, where is the notch? So this is the notch. And where is the groove? This is the groove. So this groove is having the artery and the notch is having the origin of posterior belly of digastric. Now you will have the petrous part. Now petrous part is triangular in shape, and petrous part is important for us because it protects the middle ear. Now this triangle is having a base, apex, three surfaces, three borders. So when you will have this triangular area, or you can say it is a pyramidal shape structure which is having three surfaces, three border, one apex and one base. Clear? So let's see what are the different areas of this petrous part. So first we'll discuss about the three borders. Now this is having the three border named as superior border, anterior border and posterior border. Now this is the posterior view of your skull. We have removed the occipital bone and now you are able to see the skull from posterior side. So you know that this is the superior border of your petrous part. You have to understand that petrous part is visible in norma basalis as well as inside the cranial cavity. So we have removed the cap and we have removed the occipital bone, and you are seeing inside the cranial cavity where you can appreciate the presence of this superior border. So this is the superior border of this triangular petrous part, and this superior border, here you can mark presence of this blue color line. Now this blue color line is nothing but it is a superior petrosal sinus. So this is again question of your exam, that which sinus lies along the superior border of petrous part of temporal bone. Answer is superior petrosal sinus. And this superior petrosal sinus later on open into this sigmoid sinus. Clear? And the margins are also give attachment to a one fold of your dura mater is known as tentorium cerebelli. So these are the two questions related to the superior border of your petrous part, that this border first consists of a sinus and it will provide attachment to the fold of dura mater. Now anterior border, now border which is not visible in this posterior view, which is anteriorly placed, and that border is going to make a joint with this sphenoid bone, and that is the anterior border. So this is the greater wing of sphenoid, and you will have a joint between the anterior border of temporal bone and your posterior part of sphenoid bone. Then you will have posterior border. Now my dear students, now this is your posterior border. Now this posterior border is consisting again the sinus, but this sinus is not present in the whole length. This medial part of this posterior border is having a sinus. Now this sinus is your inferior petrosal sinus. So this is a superior petrosal sinus along the upper border or the superior border, and along this posterior border you will have inferior petrosal sinus. Clear? The lateral part of this border, now this remaining area is going to form a foramen, and this foramen is known as jugular foramen. Because when you will fit the occipital bone from the posterior side, you know that jugular foramen lies between the occipital bone and temporal bone. So the remaining area is become the part of jugular foramen, while this medial part is having the inferior petrosal sinus. So in this slide there are two questions. Which sinus lies along the superior border and which sinus lies along the posterior border of your petrous part. Now my dear students, here you can appreciate that this is your posterior part, and this posterior part is clearly visible to form this jugular fossa or jugular foramen. Now here on the posterior border you will find there is a presence of inferior petrosal sinus, and along this you will have the superior petrosal sinus here. So in this view, now this is your superior view of Norma basalis. You have removed the cap, and now inside the cranial cavity you are able to see that this is a triangular part of the petrous bone, and this triangular part is showing this is the superior border where you will have the arrangement of tentorium cerebelli and superior petrosal sinus, and this junction of this occipital bone and this margin of your petrous part is having a sinus is inferior petrosal sinus, and this will become your jugular foramen. Clear? Now here if you will see the overall arrangement of the surfaces and border, we first see we will remove all the remaining part of the skull bone. So, and we will isolate this temporal bone where you will find there is a 3 surfaces and 3 borders which are very well visible. So, this is your temporal bone of the right side, and you can see that this is the zygomatic process projecting anteriorly, and this inner side a triangle projection is the petrous part. Now in this petrous part, this is your superior border, this is your posterior border, and in between you will have a surface is the posterior surface. Now this is the surface towards the Norma basalis. Now this surface is the inferior surface, and this is the anterior end of the petrous part where you will have the anterior border. Now this is your posterior surface, this is your superior surface, this is your inferior surface, this is your superior border, this is your anterior border, and here will be your posterior border. So you have to keep this thing in mind. Inferior surface of this petrous part visible through the Norma basalis, while the superior surface and posterior surface are not visible because they are inside the cranial cavity. So this is the important thing to understand, that this is a triangular bone, and this triangular part of the bone is known as petrous part, and in this petrous part you can very well see that this is your posterior surface of the petrous part, which is having the area between the superior border and posterior border. Now this surface is the superior surface, and this surface is your inferior surface, and this inferior surface is visible through the Norma basalis. Now what is about the base of the petrous part? The base of the petrous part, as we have seen, is on the lateral side, and apex is facing medially. So the apex is irregular, faces medially, and base is faces laterally. And this base is going to fuse with the squamous part and the your mastoid part. So here you can see that this is your apex, and this apex is facing medially, and this should be the base which is facing laterally. But this petrous part is not a independent part, so it merged with the mastoid part and the squamous part on the lateral side. While this apex is irregular, and here is a very important question, that this apex is going to form the posterolateral boundary of foramen lacerum. So here you can see that this is the foramen lacerum. Now this foramen lacerum is a foramen which lies between the two bones. Now what are the name of these bones? Now this is your sphenoid bone. Now if you will see the anterior bone, this is your sphenoid bone. So anterior margin is formed by the posterior border of the greater wing of sphenoid, while the posterior boundary of foramen lacerum is formed by the irregular margin of this apex of your petrous part of temporal bone. So in this way there is a completion of your foramen lacerum. Clear? Then we will come to the surfaces. So first is the anterior surface. Now anterior surface contribute to the middle cranial fossa, and this anterior surface is also sometimes referred as a superior surface, and this anterior surface shows the very important features like trigeminal impression for the trigeminal ganglia. It forms the roof for the internal acoustic meatus, and there is a presence of a prominence is known as arcuate eminence. Now this is what you are able to see. When you will see this image, you have to first open the skull, you have to see inside the cranial cavity. When you will see inside the cranial cavity, you can see that this is my right side, and in this you are able to see this is the anterior surface, or it is a surface which is visible in the middle cranial fossa floor, because you know that this border, which is known as superior border, separates the middle cranial fossa from posterior cranial fossa. Now on this surface, what are the important features you are able to see? Now first, near the apex you will find a depression. Now this depression is known as trigeminal impression, and this trigeminal impression consists of trigeminal ganglia. Now this area is having the internal acoustic meatus deep and behind this trigeminal ganglia. Then you will have arcuate eminence. Now this is a very important question for your exam, that what is the reason of this prominence in the temporal bone? So answer is that this prominence is produced because of underlying semicircular canal. And which semicircular canal? Superior semicircular canal. So my dear students, whenever you are reading the temporal bone, this question is asked so many times that what is the reason of arcuate eminence in the temporal bone. So this is the arcuate eminence area, and this arcuate eminence is produced because of the presence of underlying semicircular canal, and this prominence is produced by superior semicircular canal. Clear? Then the area which is near to the trigeminal impression is for the carotid canal. So here you will have the carotid canal that I will show you in the video clip how this part of the petrous bone is contributing in the carotid canal, but not in the whole canal. It forms the anterior part of the canal. Then there is a thin plate of the bone. Now this thin plate of the bone, which is adjacent to the squamous part. Now see, this is your squamous part of temporal. We know that squamous part is a thin plate which is projected upward. Now this squamous part is receiving the junction of this triangle, and this is your petrous part. So at the junction of squamous and petrous part, there is a presence of a plate. Now where is this plate? Now this plate is here. Now this plate is known as tegmen tympani. Now in the part 1 of my temporal bone, I told you that this tegmen tympani projects downward and it appears into the roof of mandibular fossa, where it divides your squamotympanic fissure into the two parts. So that we have already discussed, that what is happen with this lower end. I told you that the lower end is going to appear in the mandibular fossa, where it is going to divide your squamotympanic fissure. Then there is a very important question. Now you will find two very small hiatus. Now here you are seeing that they are big, but they are not so much big. When you will see the dry temporal bone in your hand, they are very fine areas, and these are known as hiatus for greater petrosal nerve and lesser petrosal nerve. So you will find there is a presence of the hiatus for greater petrosal nerve and hiatus for lesser petrosal nerve. So let's see in these different images and the video clip, try to identify these features of temporal bone. So this is the cranial cavity. Now here you can see that this is the posterior border of your middle cranial fossa, which is formed by the superior border of petrous part. So anterior to this you have middle cranial fossa, posterior to this you will have posterior cranial fossa. Now in this anterior or the superior surface of the petrous part of the temporal bone, near the apex you will have an impression. This is known as trigeminal impression. Now behind the trigeminal impression, I told you that this area is consisting of internal acoustic meatus. Now internal acoustic meatus is a foramen visible here on this posterior surface of temporal bone through the posterior cranial fossa. Next to that you will have a elevation. Now this elevation is known as arcuate eminence, and this arcuate eminence, which is a prominent feature here, is produced by underlying superior semicircular canal. Then this part is known as tegmen tympani. Now this tegmen tympani will give two very fine grooves. One groove is going towards the foramen lacerum. So this is the foramen lacerum, and you will have a groove which is going towards the foramen lacerum, and one will go towards the foramen ovale. Now groove which is going towards the foramen lacerum is greater petrosal nerve, and the groove which is going towards the foramen ovale, is for the lesser petrosal nerve. So, in this video clip, we will try to see all these different features of your surfaces of temporal bone. So, here you can see that this is your inner view. Now, we have removed all the remaining bones, and now first you can see that this is the area for the sigmoid sinus. I told you that this sigmoid sinus area, that is the sulcus for sigmoid sinus, is a feature of the inner aspect of mastoid part. So, but obviously this will become the posterior surface of your petrous part of temporal bone, because behind that you will have this sigmoid sulcus. Now, this is your superior or the anterior part of your petrous part of the temporal bone, and this is your squamous part of the temporal bone. So, what are the different features which you are able to appreciate here? That when you will see the borders, now this is first you have to understand that this is the superior border, and this superior border separates this posterior surface from this anterior surface or the superior surface. Now, here you will find this is the larger area which is known as arcuate eminence, and next to the arcuate eminence this is tegmen tympani. And this tegmen tympani present at the junction of squamous part and the petrous part of temporal bone. Anteriorly, you will have the impression for the trigeminal nerve. Then I told you there are two grooves. One groove is for the greater petrosal nerve and another groove is for the lesser petrosal nerve. Now, here I will try to show you the presence of carotid canal in petrous part. Now, here you can see that this is the internal carotid artery. This internal carotid artery enters through this carotid canal and then it appears here. Now, there has to be a question in your mind that this artery will not enter straight inside the cranial cavity. It will make a loop inside the bone. Now, which bone is this? This is a petrous part of temporal bone. So, my dear students, you have to keep this thing in mind that internal carotid artery make a loop inside the petrous part of temporal bone. So, here you can appreciate that how this loop is forming. So, if you will make this part of the temporal bone fade, so we just fade this part and now you can see this bony canal is visible. So, this bony canal is very well visible now, and you will find that there is a turn. Now, this turn of the artery is taking place inside the bone itself. So, this is the important thing to understand, and this anterior wall of the carotid canal is formed by petrous part of temporal bone. So, this question has been asked so many times that is the carotid canal vertical? Answer is no. Carotid canal is having a course where the artery will change the direction like this. It is not going straight vertically in the cranial cavity. As soon as it will enter into the carotid canal, the canal itself may turn, and then this turn at 90 degree is helpful to change the direction. Clear? Now, here we can see the groove for greater and lesser petrosal nerve. So, again you have to first remove the cap. Once you will remove the cap, you will see your middle cranial fossa. In the middle cranial fossa, here you are able to see the temporal bone, petrous part. Now, here you will find there is a presence of two nerve. Now, this is the one nerve and this is the another nerve. So, you have to appreciate that one nerve is approaching towards the foramen ovale and one is approaching towards the foramen lacerum. So, the nerve which is approaching towards the foramen lacerum is your greater petrosal nerve, and the nerve which is approaching towards the foramen ovale is your lesser petrosal nerve. So, you will find these nerves here on both the side. Here also you can see. So, this area is known as hiatus for lesser petrosal nerve, and this area is known as hiatus for greater petrosal nerve. So, you have to trace the hiatus, and if hiatus will end towards the lacerum, then it is labeled as a hiatus for greater petrosal, and if hiatus end towards the foramen ovale, then it is known as hiatus for lesser petrosal nerve. Now, we will come to the posterior surface. The posterior surface contribute to the posterior cranial fossa, and this is having an important feature, that is internal acoustic meatus. So, this is your again the view where you can see this is the cranial cavity and this is your posterior cranial fossa. Now in this posterior cranial fossa, here you will find there is a presence of internal acoustic meatus, and this is a feature of the posterior part of the petrous temporal bone. Then there is one more important thing, is there is a presence of aqueduct of vestibule. Now this aqueduct lies again in the posterior cranial fossa, and it is a connection with the internal ear, and this lies behind the internal acoustic meatus. So near this area you will have a very small shallow groove, and that groove allow the connection with the internal ear, and that is your aqueduct of vestibule. So here I will try to show you what is the location of aqueduct of the vestibule, because it is very difficult to appreciate in the dry skull. So this is your temporal bone, and we know that temporal bone consists of inner ear also. So we will fade this bone and we will try to see the location of inner ear in this bone. Clear? So what we have done is we have removed your different bones, that is parietal bone and the part of occipital bone. And when you will make it fade, now you can see there is a presence of the semicircular canal loop and the other part of internal ear. Now from that membranous area of your inner ear, a duct is going. Now you can see this duct. Now this duct is known as aqueduct. Now we are talking about this aqueduct of vestibule. Now this duct, which is known as aqueduct of vestibule, is having a connection here. So this is the important part to understand, that where is the aqueduct. So this is the aqueduct of vestibule. Now this aqueduct is having an opening here in the posterior cranial fossa, and its one end is connecting with this vestibule of inner ear. So my dear students, this is your position of internal acoustic meatus, and behind this internal acoustic meatus there is a very shallow groove is present, which is very difficult to appreciate, but you have to understand that aqueduct of vestibule is a connection of inner ear inside the cranial cavity, and this connection is vestibule or aqueduct of vestibule. And here you can imagine how it could be present, because there is a presence of inner ear inside the petrous part, and this is your cranial cavity, and this connection lies here. Clear? So my dear students, the aqueduct of vestibule is having an opening into the posterior cranial fossa through this posterior surface of your petrous part of temporal bone. Now we'll move to the inferior surface. Now this inferior surface is very well visible through the norma basalis of your skull. So in the norma basalis, you will find the two very important features in the petrous part. One is the carotid canal, and second thing is that it is going to make a jugular fossa. Now in this view of norma basalis, now what you are able to see, this is the mandibular fossa, and next to the mandibular fossa, this is your tympanic plate, this is tympanic plate, and near this apex of the tympanic plate and behind this you will find a circular area, this is carotid canal, and behind the carotid canal the part of jugular fossa is formed by the temporal bone, and the remaining part is contributed by the occipital bone. So you will have a jugular fossa and you will have the carotid canal on the inferior surface of the petrous part of temporal bone. Now this image is showing the norma basalis, where you can identify that this is the apex of petrous part, this will be your foramen lacerum, now this will be your carotid canal, and this here is the jugular fossa or jugular canal, which is half is contributed by the temporal bone and half is contributed by the occipital bone. Now we will move to the next part, is tympanic part. Now the tympanic part is formed by curved plate of the bone, and this curved plate lies below the squamous part and in front of mastoid process. Now here this is your mastoid process. So in front of the mastoid process, below this squamous part, here you can see this plate. Now this plate is your tympanic part of temporal bone. So tympanic part of the temporal bone is visible here, which is lying below the squamous and in front of the mastoid part. But it is very easy to locate this bony plate in the dry skull. How? For that you have to look for external acoustic meatus. So this is your external acoustic meatus. Now when you will see the boundaries of external acoustic meatus, what you will find that this plate is forming the anterior wall of the plate, external acoustic meatus. So this is going to form your anterior wall of the meatus. Then it is form the floor and some part of posterior wall. So this is the posterior wall. So some part of the posterior wall and this floor. So this is forming the anterior wall, floor and some part of posterior wall. So you will find that it is a curved plate and this curved plate is contributing in the external acoustic meatus. So if you want to find out this bone in the dry skull, my dear students, you can do two things. First, you will find out the mandibular fossa. Then you should find out a fissure that is known as squamotympanic fissure. The part behind the squamotympanic fissure is the tympanic plate. And when you will trace this tympanic plate laterally, you will find that it is forming the anterior wall of external acoustic meatus, floor of external acoustic meatus, and part of the posterior wall of external acoustic meatus. And this margin of this tympanic plate is known as lateral border, and this lateral border is also forming the margin of external acoustic meatus. While this remaining part of the external acoustic meatus is contributed by the squamous part of this temporal bone. Now we'll move to the last segment, that is styloid part of temporal bone. Now styloid process is a long and pointed area. You know that it is a styloid process and it is directed downward, forward, medially. And the important thing is that this process lies between parotid gland and internal jugular vein. So I will tell you this in the coming slide where we will see the video clip how it lies between the parotid gland and internal jugular vein. And the base, now this part, that means the base means this upper part is related with the facial nerve. So this is again a question, and its apex is crossed by external carotid artery. That means at this point you will have relation with external carotid artery. And you know that this styloid process is going to form a styloid apparatus where you will have 3 muscles and 2 ligaments. So this is what we are going to see here. You can see that this is your styloid process. Now outside this is the parotid gland, and deep to that you can see that this is the internal jugular vein. So this is the first thing, that it lies between the parotid gland and internal jugular vein. The second thing which you are able to appreciate here, that the base is related with the facial nerve. So here I hope you can see that this is your facial nerve. We know that facial nerve will come out from the stylomastoid foramen, and as soon as it will come out from stylomastoid, it will enter into the parotid gland and divide into the branches. So this is the styloid process where you will have the relation with the facial nerve. Clear? Now what are the other relation which you have to appreciate in this video clip? That if we will remove this parotid gland, if I will remove the parotid gland, you will find the more relation of the styloid process. So this is the first thing, that you have to understand that parotid gland is outside the styloid process and internal jugular vein deep to the styloid process. Now from this styloid process you can see that there is a relation of the facial nerve on the lateral side. And the another important thing, you can see the origin of muscles and the attachment of the ligaments. Now these muscles and the ligaments which are having attachment with the styloid process are known as styloid apparatus. So one of the ligament is here, this is known as stylomandibular ligament. Now one of the ligament is here which is known as stylohyoid ligament, which is going from styloid process to the hyoid bone. In the same way, you will have a muscle which is going from styloid process to the tongue, styloglossus. So you have to keep this thing in mind, that styloid process is a very important feature of the temporal bone, because if this styloid process will get fracture, it may causes damage to the facial nerve also, and it may cause damage to the vessels which are present all around the styloid process. Clear? So now, my dear students, at the end of this second part of temporal bone, you are having the detailed idea about the petrous part of the temporal bone, tympanic part of the temporal bone, and styloid part of the temporal bone. So this is all for the session. Thank you.